All right, let's talk about Canada's healthcare system. It's this huge, complex thing, right? We're going to break it down, starting with the big ideas behind it all, and then get right down to the people on the ground, the ones providing that hands-on care every single day.
Okay, so here's our game plan. First up, we'll get into the story of Medicare. Then we'll cover the rules of the road. After that, we'll walk through what it's like for you as a patient. And finally, we'll zoom in on the folks who actually make it all happen.
So to really get a handle on how our system works now, you've got to go back, way back. Let's start with the big question. What even is Medicare, really? And here's the absolute key takeaway. The whole point of the system is that you get care based on how much you need it, not how much money you have in the bank. That's the promise, right at its core. Now, this whole thing didn't just pop up out of nowhere. It took decades to build. It actually started out as this really bold experiment in just one province, Saskatchewan. From there, that little seed of an idea grew, became a big federal-provincial deal in the 60s, and then, finally, in 1984, it became the Canada Health Act that we're all familiar with. And you know what? It's still changing. The focus is really shifting from just, fixing people when they're sick in a hospital to keeping people healthy and bringing that care right into our own neighborhoods. Okay, so how does this all work? Let's crack open the National Healthcare Playbook and see who's calling the shots and what rules everybody has to play by. Think of it kind of like this. The federal government writes the main rule book. That's the Canada Health Act, and provides a lot of the funding. But it's the provinces and territories that are the coaches on the field, actually running the plays and delivering the care. And that rulebook? Well, it's built on 5 core principles. Just 5. But they're super powerful, and they're there to make sure the system is fair for every single one of us. So these 5 principles are really the bedrock of the whole system. They make sure it's public, a nonprofit, that it covers everything that's medically necessary, and that it's for everyone. Plus, your coverage follows you if you move within Canada, and most importantly, you can get care without having to worry about user fees or other financial roadblocks. Right, so what does this actually look like for you when you need to see a doctor? Let's map out what a typical journey through the system looks like. So you pretty much always start at step 1, primary care. That's your family doctor or a walk-in clinic. If you need something more specific, they'll refer you to step 2, secondary care. That's a specialist or getting a test like an MRI. And then for the really heavy-duty stuff, like major surgery, that's step 3, tertiary care. But here's the thing, a really big change is happening right now. More and more, the system is trying to move care out of big hospitals and bring it right into people's homes. It's better for quality of life, and it helps manage costs too. And that idea of care at home, well, that brings us right to the front lines. This is where the big ideas of the system become a real person helping another person. Let's take a closer look at one of the most important roles in this whole picture, the support worker. So care is delivered in 2 main ways. You've got your facility-based care. That's the traditional stuff in hospitals or long-term care homes. But then you have community-based care, which is the part that's really growing. Care delivered right where someone lives, focusing on keeping them independent. And man, just look at all the different places these support workers are needed. It's incredible. They're literally the backbone of care, everywhere from private homes and hospitals to hospices and adult day programs. They are everywhere. And their job is so personal, so direct. They're helping with the absolute essentials of daily living, they're providing companionship, and they're making sure people can stay in their own homes safely. It's truly vital work. Being a support worker is a job of real extremes. And it kind of mirrors the pressures on the whole system. On one hand, the rewards are just huge. You get to build these incredible relationships and see the difference you're making every day. But on the other hand, the challenges are no joke. We're talking about heavy workloads, not always enough staff, and a job that can be really tough, both physically and emotionally. But at the end of the day, this quote just says it all, doesn't it? That's the goal. That's why they do what they do. It's about making a real, tangible, positive difference in someone's life every single day. So this is where we'll leave it. As our country gets older and more of us need this kind of care, it leaves us with a really big question, right? How do we make sure we're taking care of the people who are taking care of us?